Okay, ready? Boop, 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 boop. That was a little delayed, wasn't it? All right, and we're gonna do this.
All children with progeria develop severe progressive heart disease or atherosclerosis, and they die at an average age of 13 years. They also have low bone density, what in adults we call osteoporosis, and other problems such as losing their hair, skin problems, joint contractures, an inability to have body fat, and they're unable to grow.
The clinical drug trial involved 28 families from 16 countries speaking over a dozen languages. The Progeria Research Foundation brought these families in from all over the world. Some of these families traveled for 2 days every 4 months to get here, and then go through a rigorous few days of testing.
Remember how difficult it was to get her to swallow? Not just too long ago.
We saw a significant increase in their ability to gain weight. We saw some significant changes in the cardiovascular system, the part of this disease that worries us the most, since that's the part that accounts for death in virtually all of the children.
After 2 years of treatment, the blood vessels of the children in the trial look more flexible, less stiff, more like the blood vessels of a child and less like the blood vessels of an 80 or 90-year-old.
We're very excited about the results from this first ever clinical drug trial and the fact that these FTIs have proven to be an effective treatment for the children.
We've always had hope from the beginning that things will turn out well, and now that they've told us that things are, certain things are looking better and the drugs are doing good things, it's just what we've wanted the whole time. I mean, whether it's a little gain or a big gain, we had nothing 3 years ago.
We've really been able to accomplish in just over 10 years what others have taken decades to achieve. Really a prime example of successful translational research, taking the research from the lab to treatments.
The speed of the formation of the Progeria Research Foundation to the identification of the mutation, to the testing of experimental drugs in animal models to show that they get better, to the formation of the clinical trial, which happened really in a very short period of time, less than a decade, is incredible, really.
It feels like we won the lottery, maybe. That would be a good way to explain that an effective treatment has been found. We're thankful that there is something out there, otherwise as parents, we would be lost.
The understanding that we gain from children with progeria may be important not just for children or families with progeria, but for the larger population. For example, children with progeria produce a huge amount of this abnormal protein that appears to cause this appearance of premature aging. When people began looking in older and older normal people, one of the things we see is that the amount of this protein goes up in your body. It's like one of the clocks in the body that tells your cells that you're getting older and it may be time to stop working soon.
We are now in the course of testing this drug along with other drugs. We're just going to keep on going so that we find even more effective treatments and get to the cure.
We're hoping now that there is an effective treatment, that more people are going to take a really good hard look at progeria and say, no, wait a minute, maybe we can help.
We want them to be living till they're 80. We want them to be having families. We want them to be dying of true old age.